When you first log into the Healthcare Assistant software, the first thing you have to do is set up your agency's information. You can do this by clicking on Administration and Agency Setup Information. The agency setup consists of information on the agency and definitions of several items that an agency can set to customize the Healthcare Assistant. The Agency Information section contains general information on the agency, such as the name, address, telephone numbers, mailing address, and classification. Simply replace the demo information with your own agency's information. The Offices and Locations setup is where the agency can specify the types of patients the agency accepts and the different services provided by the agency. An agency can also list any branches the entity may have, but each office must have the same provider ID number. The first office is the main office, and any additional offices are considered branch offices. If there is only one office, you will list the branch type as no branches. To add a new office, click on the New button and complete the form that pops up. To edit an existing office, highlight the office and click Select. To delete an office, simply click on the Delete button. Provider ID numbers identify the agency to the fiscal intermediary. The provider ID number is mostly used on the claim forms when submitting claims for reimbursement. The National Provider Identifier, also known as the NPI, is a 10-digit code assigned to healthcare providers and can be entered in the space provided. The preceding 80840 of the NPI is a code for the United States. The Social Security number field generally applies only to agencies run as a single proprietorship. This would be the space the registered owner would place their Social Security number. In this case, we'll leave it blank. The Employer ID is where the agency places the Federal Employer Identification Number, or Tax ID number. The Group ID is for the Group Insurance ID. Under Intermediary is where you can place the name of the fiscal intermediaries you are associated with, and then enter the provider or license numbers assigned to the agency for the corresponding intermediary. The items in the General Preferences tab contain default information when adding new patient records, such as employment status, marital status, gender, and service area. It also includes other options pertaining to charge posting to the General Ledger, such as warnings if there is a visit overlap, or a visit posted during a transfer or after a discharge date. You can also set the password for the username supervisor under the security options. Under the Other Options section, you can set the option to show paid claims while posting RAs in addition to the unpaid claims. Also, set up the starting patient code for automatically assigned patient numbers. The payroll company code is assigned to the agency by a contracted payroll service such as ADP and Paychex for payroll processing. The same follows for the batch ID. If you do not have any of these services, they can be left blank. The Home Health Preferences contain items that determine current and former CMS guidelines regarding the plan of care and OASIS. The days between verbal SOC and SOC item is entered into field 23 of the CMS 485. The verbal SOC is the date the request for home health service from the referring healthcare entity was received. For most agencies, the verbal SOC date is the same as the SOC date, meaning that the start of care date is the same day the patient was referred to the agency. In this case, this item should be set to 0. If the agency usually sends a nurse on the days following the request, the verbal SOC is 1, meaning 1 day prior to the actual start of care. The default period span determines the default number of days for a certification period. For home health, we will leave this at 60. We will leave the default period to exactly 60 days and leave the option for the research start date to the day after the previous certification date. Under Options affecting the OASIS, checking this option will allow the agency to enter a number of days. When an OASIS is locked, the program will show a warning if the difference between the lock date and Moon 90 date on the OASIS is greater than the number of days entered here. If unchecked, a locked OASIS will be locked with the current date with no warning. The Claim Options displays preferences concerning the rules on creation and content of claims. we will leave the billing period at billing period entered. This option will write to the claim statement period the dates of services stated by the user at the time the claims were processed. The plan established date will also be left as a default, which is SOC date. This option will write the SOC date on occurrence code 27 of your claim. The medical supplies are required to be reported to Medicare, so we will leave this option as is. You also have the option for the software to automatically place claims on hold if there are claims containing services with missing notes. You can also require a first billable visit to be posted to have the program automatically generate the start of care wrap for the patient. If Allow Auto Creation of claims that do not include billable visits is checked, visits that are marked as non-billable will be included to the auto generation of claims. Billing units is the definition of the length in minutes of a billing unit. We will leave this as a default of 15 minutes, which is a standard for Medicare. The minimum visit is the minimum length in minutes by the caregiver to stay with the patient to be considered a performed visit. We will also leave this as a default. You can also check this option to have the application automatically change the last digit of the HIPS code from a letter to a number to report that no medical supplies were used. The alternate procedure revenue codes are options used in the chart of accounts to be able to automatically translate a standard procedure code into an equivalent code acceptable to the given intermediary. In this section, you will enter the names of the intermediaries for which the standard procedure code will be translated into when printing claims for submission to these intermediaries. For example, a 551 or SN visit will be translated into G0154. This is only the place where you enter the names of the intermediaries. The actual codes can be entered later in the chart of accounts. Whenever a plan of care is created, the default safety measures and orders are automatically inserted in the corresponding fields of 485, meaning any text entered under default safety measures will automatically populate field locator 15, and any text entered in default orders will automatically populate field locator 21 of each new plan of care. This assists the agency so that it eliminates repetitive typing for safety measures and orders. For fee schedules, enter the name of the intermediary group for which separate fee schedules will be maintained. This field can be used to document different fee schedules that will be charged to the intermediaries, the reimbursement rates or contract fees, and also the cost incurred by the agency for completing the service. The actual amount for these intermediaries are set in the chart of accounts, similar to the alternate procedure code setup. For certificate, you will enter the name or description of each license or certification that will be required from each caregiver and tracked by the caregiver list report for compliance. These items will be asked for when entering information for a caregiver. The service area section shows the service area the agency covers and also contains the MSA and CBSA codes. The PPS factors are also included in this section. Note that it is the responsibility of the agency to maintain and ensure the accuracy of these tables. The results of calculations arising from the use of these tables are meant only as estimates and are not intended as the definitive and final results. The definitive and final results rest with your intermediary. You have the choice to show only the service areas that are used by the agency, which are automatically shown based on the zip code of patients entered in the software. You can also choose to view the service areas in the same state or all service areas. This section determines the presentation of the scheduler. You can choose the day of the week the schedule starts on, the default time in and time out for an appointment, the span of minutes for the appointment time, and also activate warnings for schedule overlaps and specific caregivers being required to create an appointment. The medical supply section is required if your agency is using McKesson Medical Supply Interface to export data from Healthcare Assistant. The assigned PPS ID is the number used to identify patients from this agency whose supplies will not be billed for in the McKesson system. The assigned non-PPS ID is the number used to identify patients from this agency whose supplies will automatically be billed for in the McKesson system. The Add HCPCS code option controls whether the Medicare HCPCS is included at the beginning of the medical supplies in the charges drop-down list. After completing each field of the agency setup, click Save.